Okay, so I'm Dr. Sherry Towers. I am a data scientist. I'm also a dynamic modeler. For many years, I actually specialized in the modeling of contagious disease within populations, many different kinds of diseases, pandemic flu, COVID, including COVID. I still do some disease modeling from time to time. And around 10 years ago, I got the idea to start looking at violence as a contagious process, and specifically looking at how we can apply the models that we use for the spread of disease in population to the spread of violence, with an eye towards quantifying how contagious certain types of violence are. And once you have, those models for the transmission of violence in a population, just like when we're modeling the spread of disease, it can help us aim where the best bang for our buck is on intervention measures. So where the best return on investment would be for different types of intervention measures aimed at different stages of the contagion process, aimed at keeping people from who are susceptible to getting infected, people who are infected from really basically infecting others, and on down the way. So in 2014, I started looking at extreme violence, mass killings, and school shootings. And the team that I led was the first to quantify that those indeed are contagious, that around 20 to 30% of those kinds of tragedies actually appear to be inspired by a like tragedy that occurred in the relatively recent past. So since then, I have moved on to look at other forms of violence. So in 2020, I was partnered with Cure Violence Global and the Carter Center, where we were looking at trying to do temporal and geospatial hotspot location of partisan violence, both on the left and the right, leading up to the 2020 election. And so that project eventually kind of led into this project that I'm working on with you gentlemen, where we're looking at extremist violence in the Pacific Northwest, which is a hotspot for partisan violence in the US. Certainly not the only place where it occurs, but it's just the amount of partisan violence in the Pacific Northwest is disproportionate to the population share there. And so we've been trying to look at that, looking at it just like you would from a disease perspective. For when you have a disease spreading in the population, one of the things you really need to do is to do hotspot geolocation and look at the factors that are going on in that community that are increasing the probability of the spread of that disease. And so this has been something that has been taking up our time for the past couple of years now, where we've been looking at, just like from a public health epidemiology standpoint, as if it were a contagious disease, looking at the risk community and personal risk factors for being affected with the idea to do that kind of violence and then actually perpetrating. So that's what I do.